Can't see all the audience, but I can see your names, and thanks for being here so bright and early. I was just sharing with my colleagues that anymore, it's kind of rare that I'm this dressed up at 8 a.m. in the morning. And I know they the same for them. So we appreciate everyone being up and with us this morning. And of course, it wouldn't be a Zoom event if my dog didn't bark in the background. But yeah, we're just gonna have to live with it. All right, well, I think we will go ahead and get going with this morning's program. Hi, everyone. Thanks for Jean starting us off by putting a hello in the chat. Please feel free to introduce yourself there to the rest of the audience members and our panelists. This is Wake Up with United Way, and we are hosting this event every second Thursday of the month at 8 a.m., taking on different topics of importance to our community and especially our nonprofit and social services community. So this, I'm Efrat Pfefferman, Executive Director of United Way of Monroe County. And this project is a joint collaboration with IU's PACE program, Political and Civic Engagement Program. We're delighted to have our partner, Mark Fraley from that program here with us. And we also want to say a big thanks to a couple of our season sponsors, the Greater Bloomington Chamber of Commerce and the Bloomington Board of Realtors. Today's topic is one that our community and a certain segment of it has been really immersed in for several months now. We're going to talk today about adapting our shelter system to COVID. And we have a great panel that represents pretty much our primary shelter and transitional housing providers here with us today. I'm going to give a quick introduction, but then turn it over to each of them to say a little more. I'm delighted to have Dana Jones from Wheeler Missions Men's Shelter, Debra Morrow from Middle Way House. We have Chase Techentin from New Hope for Families, the shelter, and Beverly Calender-Anderson from the City of Bloomington Community and Family, oh my gosh, I'm botching it. It's too early. She's going to say it all herself. From the City of Bloomington. Keirsten White from Shalom and the Community's Isolation Shelter. And as I said, if I could turn it over to our panelists to say a little bit more about your role and your organization, and perhaps, you know, as it pertains to the topic today. Maybe we can start with Dana. Please take it away, and we'll unmute you. Or you may have to unmute yourself. Are you able to do that?
There we go.
There we go.
Well, good morning, everyone. I'm Dana Jones. I'm the director of Wheeler Mission Center for Men, Bloomington. Wheeler Mission exists to provide needed goods and services to homeless and impoverished of South Central Indiana without regard to race, color, sexual orientation, creed, national origin, or religion. Wheeler has been in existence since 1893 in Indianapolis and is well known there. However, it's still fairly new in Bloomington, having only existed since 2015. However, we are a major provider of services for those experiencing homelessness here in the Monroe County area. On average, each year, Wheeler Bloomington provides a shelter to over 900 people, and last year alone provided over 44,000 nights of lodging and 85,000 meals. In addition, Wheeler provides not only shelter 365 days a year, but also a meal service and day room service to the public 7 days a week. These services include showers, clothing, and case management to those in need. We also provide programs of varying lengths designed to meet the need of those seeking additional soft skills and job readiness so they may be equipped to successfully re-enter the community after experiencing the crisis of homelessness. And of course, its various causes. In addressing addictions, Wheeler Mission provides a long-term, year-long in-house recovery program located on 285 acres in northern Monroe County at our Camp Hunt site on Fish Road, with intakes for that program being done here in Bloomington. Recognizing that we can't meet the great demands that are before us in our community, we actively collaborate with many other agencies in our continuum of care to ensure that each guest seeking services at Wheeler is able to obtain that which they need to overcome barriers to housing, healthcare, and other of life's essentials. So there's a little history of what we're doing here at Wheeler Mission.
Thank you so much. How about Debra from Middle Way House?
Hi, I'm Debra Morrow, the director of Middle Way House, and Middle Way House has been in our community since 1971. We provide supportive services to individuals who have experienced domestic violence, sexual violence, stalking, and human trafficking, and our services include our emergency shelter. We have a 24-hour crisis and helpline, on-scene advocacy program, transitional housing, permanent housing. We have a transitional housing building with 28 apartment units. In permanent housing, we have 6 units. We have legal advocacy, which serves individuals who might need help with protective orders or just support as they're going through a divorce. We have an on-site childcare, youth programming that provides tutoring and help for kids after school. We really work to meet the needs of survivors when they come to us where they're at. Whatever a survivor needs from us is really what we want to give them. We don't ever force our services on them. We let them choose which of our services they want to use. We just work very hard to meet people where they're at. We also provide prevention and education in the community. Our mission is to support all survivors of domestic violence, sexual assault, and human trafficking, and to educate the community through outreach and prevention programs. And we hope we're meeting those needs.
Thank you, Debra. Keirsten.
Hello, so my name is Keirsten, and I am the director of the Monroe County Isolation Shelter. I work for Shalom Community Center, and Shalom Community Center has 4 different programs through which they address poverty in Bloomington. One is the Housing First program. They have 3 apartment complexes through which they house individuals. They also have a day shelter, and then they have a night shelter, an emergency shelter called Friends Place. And then they also have a rapid rehousing program. Back when all of this began in March, they started brainstorming how they would isolate individuals who were experiencing homelessness and started presenting COVID symptoms and prevent spread in shelter systems, because they are, tight spaces where spread can occur really quickly. And so they started the Monroe County Isolation Shelter. That has since expanded to serve 6, initially it serves 6-county region for the state of Indiana, and we are also now expanding to serve central Indiana. But our site is located at a motel, and we get referrals from hospitals and shelters around the area. Whenever an individual presents with symptoms and is tested for COVID, they isolate here while they wait for their test results. Or if they're confirmed positive, they complete isolation here at the shelter. Or if they've been exposed to COVID, they complete quarantine here. So we have a few monitors who serve at our shelter, and we still are funded through the state and working with Shalom Community Center.
Thank you, and we'll talk a lot more about the isolation shelter, since all of these panelists and organizations that they represent really came together early on to work on this joint solution for the community. So thank you. Beverly.
Good morning, everybody. I'm Beverly Calender-Anderson, and really glad to be here and on time. And I am the director of the city's Community and Family Resources Department. And early on in the pandemic, the mayor convened a emergency economic and social services working group. And they were two groups. One was economic, one was social services. And I have been the convener of the social services end of it. And by way of that, working with the isolation shelter, we became the fiscal agent for the grant received to do the isolation shelter. So I have the really good luck of meeting with most of these folks 3 times a week as we convene and talk about what's happening in the shelter, what's happening in the community, how the city can be more supportive, and just working with them in a very collaborative way. And so that is how my role fits into this particular subject.
Thank you, Beverly. And finally, Chase.
Hey, yeah, I'm Chase. I'm the shelter director over at New Hope for Families. New Hope for Families started in 2011. We're a younger organization here in town with a really simple idea conceived by some IU health administrators. And that motivation was that they didn't want to release moms from the delivery room with their new babies into homelessness. There weren't a lot of options for moms. There certainly weren't options for moms and dads if they couldn't couch surf or stay with friends and family. So they came together and they refitted 2 residential homes there on 2nd Street. And now we can shelter 7 families at a time. They live in a private room and they share the kitchen and common spaces with the other families, which presents some problems for social distancing that we'll talk about. But then early on, just in a few years, they realized families are not able to, or families face some different challenges from single adults who are experiencing homelessness, especially childcare. So our main focus is to help people get into a new lease, right? We want people to get into affordable housing as quickly as they can and get out of the crisis of homelessness. But families can't get that income, they can't go to work without childcare. So they started a childcare program called the Nest, which has evolved into a really top flight early learning center for kids birth to school age. They are the highest ranking you can get for a lot of the state's different accreditation markers. So we're really, I don't work there, so I can say we're really proud of the Nest, and they do a tremendous job over there. They have a consistent cadre of kids from the community, and then they have loose spots for shelter residents. So there's always a consistent group of children to provide some stability, and then children who are staying in shelter in that transition can join that little community and receive that top flight childcare, and a lot of them stay on at the Nest if they don't transition into a different childcare afterward or go to school in the following year. So those are the 2 main things that New Hope does. We'll talk mostly about our shelter program, which, as I said, follows a housing first model. We can serve about 30 families per year through our 7 rooms, and on average, on a given year, somewhere between 70 and 85% of those families exit our program to an affordable lease. The people who don't enter an affordable lease, a lot of them go stay with friends or family or something else. Very, very few of them, especially not the children, which really going back to that original germ of an idea for the shelter, very few children sleep outside because we are in town. The other thing we do to keep children from sleeping outside is we have a partnership with the Bloomington Police Department to put families with children up in motels when there is an emergency and they are not able to couch surf and we don't have space and shelter for them that night. So truly the community has come around New Hope and made it possible for us to ensure that children are not sleeping outside and that we can find a safe option for them, whether it be the hotel for a short period of time and then figure out a safety plan for what's next. So
Thank you.
Yeah.
Yeah, and it's great to see all of the introductions from our audience members in the chat. Please continue to say hi if you haven't. It's nice to see some of our nonprofit partners. So we also have from Shalom, Reverend Forrest Gilmore, I saw say hi, and several of our elected officials and candidates for office. Great to have you here, because this is, there's a lot of policy implications here, and we'll get to that discussion at the end as well. If you have any questions for our panelists, please put them in the chat box. I'll keep an eye on that, and we'll try to get to some of those. So yeah, and United Way's role, we year after year support safety net programs in our communities, and as well as programs that provide people with opportunities. But in this context, we launched a relief fund in March with support from many partners in the community and many individuals and businesses that stepped forward. And this was one of the priorities, our safe shelters that had to make a lot of adaptations to COVID, with physical distancing needs and hygiene and sanitation needs. Oh, I see Emily from New Hope there as well. Hi, Emily. Good to see everyone. And in fact, the $1.4 million that we've distributed so far from that relief fund, I was trying to do the math, a good percentage of it has gone to support shelter and transitional housing organizations at this time, just reflecting the priority. It's a population that, at the last count is close to 400 in our community. Feel free to correct me if you have more updated information. I think that's the 2019 point in time count. But, if you've ever visited a shelter, they're bunk beds, right? And they're not spaced apart, and people are congregating for meals, and they're congregating for socialization. And so suddenly, here comes March and the realization that we're not equipped for this, right? So could you each talk about sort of that thought process within your organization around that time? What were you thinking? What were you realizing? We can also talk about how you all came together to discuss the community-wide solution of the isolation shelter. Beverly, I might ask as an observer of that before really getting into the thick of it. Could you share with us what you saw in terms of the nonprofits coming together around the isolation shelter idea? And then I'll turn it over to the rest of the panelists to talk more about your internal organization. I think we'll do it that way, if that's okay.
Well, certainly as the city, in late February, March, as we knew the pandemic was impacting our community, we became concerned about public health, for the entire community. And what I know from working with the shelters and knowing how close they were, just thinking that an outbreak in a shelter could, really not only devastate the guests at the shelters, but then could spread throughout our entire community. And so before I got involved, and I was not involved from the beginning, but before I got involved, I know that Shalom and Wheeler and Middleway and New Hope started to work together to open an isolation shelter just so they could physically distance their guests on Hillside. And they leased a warehouse space and they worked together to do that. And so and then after that, a grant came down from the Department of Mental Health and Addictions through SSA. But yeah, I think we were all concerned that because they were in such close quarters and we were, being advised to socially distance and, to do all the hygiene, washing hands and not touching our faces and washing hands, and so it was a lot of hand washing, that we were concerned about how that was in that particular community, how to get that education done, and how to have people distanced. And so, like I said, these agencies stepped right up and started to solve the issue themselves. And then we got involved in it later on, but they really took the bull by the horns and started themselves with the first isolation shelter, which is now where Friends Place is for social distancing. Yeah.
Thank you.
Mm-hmm.
Yeah, I echo that because this group and Forrest and Emily, Debra and Dana, you were all problem solving right away, and had the plan to submit for funding from United Way. In a matter of days, it was pretty astounding, doing things that we might not have thought possible a few months back. So Keirsten, how's the isolation shelter going now? And if you want to also speak to the Friends Place and some of the adaptations that have been made over the last couple months, that'd be great.
Yeah. So there have been a lot of changes that have happened over time. There's really just been constant adaptation, I think, on behalf of every program at Shalom Community Center, including the isolation shelter itself. We've grown with what research has come out about the virus and what's been effective. And so in the beginning, Shalom did shut its doors, and people received services outside, meals and then mail. They could go inside to get showers, but the center itself was not open to the public indoors. And since then, people have been allowed inside with masks being enforced. And that's been a great service to the community. People who are experiencing homelessness really don't have anywhere they can go inside. One individual was telling me he felt like when all this started, he's a guest at Shalom, he lost all of his defense mechanisms because he used to be able to go into the library and play games and do other things. And so Shalom being open to the community, I think, is a really important resource for people right now. With the Friends Place shelter, they moved to the original location of the isolation shelter, which was initially a warehouse. And once that grant funding became available, the isolation shelter was able to move to a motel that had individual isolation rooms, which was much better because it's still in discussion about the virus being airborne. And it's likely that it does remain in the air for a while. And so having those individual isolation rooms was very important. The shared area of the warehouse wasn't ideal for an isolation shelter. So now people are able to socially distance at the emergency night shelter of Shalom, which is a great, another prevention effort that has been great and I think really effective at preventing the spread of COVID in the homeless community. And then the isolation shelter actually just recently moved to a hotel with even larger capacity options. So right now we have 14 rooms. 3 are used for staff and 11 are available to guests as isolation rooms. And we have the ability to scale up to 41 rooms and then up again to 61 rooms to open up the entire hotel to people. But we are also expanding to serve all of Central Indiana in the next couple weeks. And so that's the state of the isolation shelter itself right now.
Thank you. And each of you can refer people to it. Has anyone had to do that? Okay, Dana, if you want to talk about that as well as just Wheeler and the changes you've had to make and the adaptations you've had to make over the few months. I'll turn to you next.
Thank you. Well, wow, this kind of rolled out in stages for us. We began to see this out on the West Coast, and but February, March is a very challenging time for us here at Wheeler anyway, because we're still in what we call winter contingency. That means that anyone that comes to us, we're going to give them a warm bed for the night to keep them from the harsh conditions of winter. And so we were serving at that time approximately 120 men every night and about 35 women every evening. So altogether about 155 people we had here in our facilities. And it's a very busy time, and our day rooms were just overflowing. Staff was burdened with security and housekeeping and just keeping up the environment. And so we were all looking forward to the spring, not a pandemic. So the pandemic strikes, and that starts coming out, and we begin to hear rumblings from it from initially the West Coast, as I said earlier. And we've got emergency action plans for everything. Wheeler as a whole, from here to Indianapolis, we cover everything that you can think of, from tornadoes to earthquakes to active shooters to medical emergencies. But we sure didn't have an emergency action plan for a pandemic. And so as we looked at this, we began to look at the states around us and what they were doing. And so immediately we started plugging into our continuum of care. And I think that's the big key here, is that collaboration that you had noted to earlier, Everett, about how we started working together in that. So here we were with 100+ people surrounding us all the time. And we are told now we've got a social distance. But however, the ironic thing here is a problem that we had last year with the hepatitis B outbreak we had last year actually prepared us for some of this. We had developed a really close relationship with the Monroe County Health Department and Penny Cadell and her staff over there, Christina Kemp, a big one, and great folks there. So in working with the health department, it was a realization that, hey, we've got a social distance, face mask, hand washing, sanitizing, all that's a big must. And remember, during this time, our facilities are packed. I mean, we're just crowded. And so we immediately begin instituting safety protocols at our facilities with direction from the Monroe County Health Department, from ISVH, Indiana State Department of Health, from the CDC, and also giving direction to us from what we call CityGate Network, which is an association of shelters across the United States. They were giving us information about how they were working to prevent the virus spread in their shelters. Unfortunately, our greatest issue at that time was the need of PPE, if you all recall, and to put some of these things into place. We found ourselves kind of in a big vacuum there for a little bit of time. The state and county actually helped us in providing a state of emergency, which permitted us to utilize one of our buildings to move into, as Keirsten had noted. We were able to overflow into one of our buildings to shelter people into another building. So we were able to expand spaces between our beds. So we now have 4 to 5 feet between our beds, and which is what the CDC was recommending. Additionally, the Bloomington Health Foundation gave us grants to lease a tent, which we put in our parking lot to expand our day room. And they also granted us funding to buy hand washing stations to put at each of our entries of our doorways. Then finally, the Community the Community Foundation provided grants for purchasing thermometers and face shields, that PPE that was most desperately needed. So now, and additionally, Cook Incorporated also provided gowns to cover our cleaning crews so they could go through and do deep cleans in our building. And then finally, the United Way and the Jack Hopkins through the city were providing funding for increased staffing to care for all this expansion. Because as I know every provider here endured, was that need of more hands on deck to get the job done. And so that was a great challenge for us. So now when a guest comes to our building, they wash their hands upon entry. They sanitize their hands from hand sanitizer from Cardinal Spirits. They have their fever checked with infrared thermometer. They go through a health screening protocol that we've helped develop, we collaborate with the health department to get to do for each one that comes through. And so it's amazing some of the changes that's occurred in such a short amount of time, as you noted. And we went from having 70 people in our cramped day room to 24 social distance with a 10 outside with 24 social distance. And we were still able to do a lot of things. And so because of the help in the community and the collaboration in the community, we were able to continue to remain on point to do our mission in the community to help those in need. During that time, from March to July, we were actually continuing to serve 35,000 meals. We sheltered 436 people. We gave services to 554 people, and then a total night lodging of over 14,000. So we're able to continue that mission with the help of the community. So a lot of changes, but it really was effective.
Very good. And yeah, you mentioned the Monroe County Health Department, and they were an integral part of the behind the scenes planning for the isolation shelter, for public health as it pertains to each of you. Really want to commend Penny and Christina and everyone over there, as well as the county commissioners for doing the hard work with the rest of us, and just being so supportive and accessible and available. So yeah, shout out to them. Maybe I'll turn it over to Chase if you want to speak about some of the challenges and the changes that New Hope had to make in their program. So, and you're a little different than, say, Wheeler or Friends Place, family shelter. So not single people that could be in bunk beds necessarily, but go ahead and tell us what challenges you guys faced.
Sure. So our community, and everybody if you've tuned into this, you have a pretty big stake in our community, I imagine. And you know that we're pretty well interconnected. And like Dana was saying, the hand sanitizers from Cardinal Spirits. So I just want to say we are so grateful to be part of a community that's connected and working together on this challenge. Even before the pandemic, we were meeting regularly with other shelter providers and people interested in affordable housing and relieving poverty in that way through a network called the South Central Housing Network. That's something that's put together by the state's version of housing and urban development called IHCDA, and we meet once a month. And as the pandemic was ramping up, we invited the health department to come and speak to us. So we were in late February in a room of 35 people. It was probably the last time we ever saw that many people at the same time. But they came, and they were, the county health department was tremendous in helping us understand what the CDC knew and what we knew about the pandemic at that time. And that was really the time where we also, as service providers, got together and said, we need to spread out. We need to have a plan for this. And Dana and Forrest and Debra and Emily all got together and made, like you were saying in front, made this isolation shelter happen so quickly, leveraging our, not just our knowledge about homelessness, but our board, our social networks, and the agencies that we partner with, like the city of Bloomington. Beverly got involved. So we're just so grateful for the way everybody worked together. But this has been a really collaborative effort to make sure that people are safe, especially our most vulnerable residents, people experiencing homelessness. So, and families were no different. We needed to make spots for children to be with their parents in one room. So our model at New Hope, like I said, was they bunk in a private room and they share these common spaces. So we knew right away, we have a 4-bedroom house. We knew that's probably too many people. That's too many humans in one space. So we had to work really quickly to do social distancing. And we did that in partnership with United Way. In your phase 1 community relief plan, we spent almost all that money on a hotel expansion. So we made a partnership with Home 2 Suites up on 17th and Walnut. Their staff had, purchased Christmas gifts for some of our families. So we had a relationship with them, and they were able to help us put that funding to its best use. Since they were not renting a lot of rooms in the travel industry at that time, we were able to make not only enough space to socially distance, but we were able to double our capacity when people were losing income and kind of being shaken out of a couch surfing situation, or places where, you know, they had elderly family that they were living with who were at too high a risk to have kids and other adults in the house. So we expanded capacity, just like Dane was saying. All these agencies have, unlike many parts of our economy and many industries, we actually had to double what we were able to do. And we did that with both phase 1 and phase 2 of United Way support, and leveraged a lot of community resources to make sure that people had a safe place to be that was socially distant with their kids. So we served a total of 15 families in those first months. 12 of those families moved into affordable leases in the midst of the pandemic. Some of these parents did amazing things. They not only did they keep their jobs, a lot of them expanded their hours at the jobs they were working. 80% of them left our program into an affordable lease. So we were so pleased to work together with y'all to socially distance now, and to expand our programming. Now everybody's back. Our 7 families are back on site, and now that we know more about the pandemic, we know about how to use masks, we know about how to sanitize our common spaces, and we feel comfortable and confident that we have the protocols in place to keep everybody safe, and our families are on board with that. We had a flu outbreak a few months before the pandemic, so we kind of knew what we wanted to do to keep everybody separate, how to split up those spaces. And we also have an amazing evening staff who come in and sanitize everything every day. So we're feeling more confident about that. We have made one referral to the isolation shelter, but that was a negative test. That was somebody who was exposed to a social worker who was positive. But the last thing I heard was there has only been one positive case of COVID in shelter, which I think is an important part of the story.
Right.
When we think about homelessness, you know, when we're talking about people who are going to sleep outside or in their car, there are lots of people who do not have their own lease or do not own their own home. We're talking about a really narrow segment who have had so many troubles and burdens that they're not even able to stay on a friend's couch for the night. So when we talk about these hundreds of people, that's what they're going through, and these families are no different. So it's really important that we have been able to expand our services to help these folks. Because as the pandemic rolls on, it's going to be less and less palatable for people to double up, less and less palatable for people to have all those variables in their home. So all this was really helpful for us, and we're ready to keep on rolling and keep these people safe and move them on into their next lease.
Thank you. Debra, so you're not a homeless shelter, but domestic violence or trafficking victims may be in a state of homelessness when they come to see you. So I wonder if you can not only talk about the physical, you know, adaptations of your space, but also how have you been doing the outreach and trying to get the word out to people who now may be stuck, you know, in a situation at home that's not safe, and maybe they had plans to, you know, to exit, but then COVID comes along and everything shuts down. They can't go to work. They can't go to school. I mean, wow, what immense challenges for the world that you're working in.
First off, I want to echo all the wonderful support from the community, from the health department, and the advice that we receive from different places. Ours is different, being a domestic violence program. We know that domestic violence is the leading cause of homelessness for women. And so when they're coming to us, basically they're making a decision to leave a home that's unsafe and coming into a shelter that it's unknown what to expect there. And during a period of a pandemic, that can be a very scary place to go. So we worked very hard to make sure that our shelter was a safe space. Our families do share an individual room. If we have single individuals, they do share a room with others. So we had to limit the number of people that could be in a room for the single folks so that they could social distance. We also needed to make sure that clients could still reach us. We never closed our doors. We wanted to make sure that if somebody needed to see a legal advocate, or somebody just needed to come in and safety plan, or just to talk to somebody, that we were open and available to them. But we also realized that that wasn't going to be an option for everybody to come to us. So we had to create other ways for folks to reach us. And one of them was a chat, like a chat line, text chat, so people could contact us that way. And knowing that somebody may not be able to go to their computer and get on and look up Middle Way House and look for what type of help is available, we looked for creative ways of reaching people. We have a great partner with the Monroe County Library, and they put in one of their blogs that Middle Way House was still open, that you can still reach out to us. So we worked really hard to try to still be able to connect to people and provide services. And if somebody did reach out to us and they were wanting to leave but were afraid to come to shelter because of the pandemic, we worked with them to try to find other safe places they could go if they had family that they knew they could go to, but it was in another town. You know, we helped them arrange that, maybe bought their tickets for them to be able to go, or gave a gas card so the family could come and get them and take them there for safety. We continued to meet with people to do protective orders, but also expanded that so that they could do those over the phone if that was something that worked. We continued our support groups virtually so that folks still had that support if it was something that they could participate in. We met weekly with ICADV during the main time period between March and May. And one of the things across the state that we all noticed is that the calls were dropping. And we knew that as soon as things opened back up, that all of a sudden the phones would be ringing off the hook again. And that's exactly what happened. People did whatever they had to do to stay safe during that time period. And that's what we want. We want them to be safe. And then after they felt safe to leave or try to explore their options, then they were reaching out. We did create an isolation room in our shelter, just in case, because somebody who's staying with us may not be safe going to a hotel or something. We do definitely appreciate the isolation center, and we'll use it if we can, if we need it. We did have one person that went to the doctor for another reason and was tested. And then when we found out, this was right as the isolation center was opening, and we had them stay in that room during that time. We also had a family at our transitional housing program that was in isolation, and that brought up a whole lot of different work, like how to get them groceries, how to take their trash out, how to, you know, navigate all of these things. And I will have to say our staff have been incredible about doing that. Working with survivors of domestic violence, you know, some of the things, having somebody have to be isolated in a room or isolated in their apartment. If they've experienced trauma related to being kept in a space, that can be very hard. Masks, we have, prior to the county requiring it, we had anybody in the building wearing masks when they were in common spaces, unless they were in an individual office or in their shelter room or something. That can be very triggering for somebody that's experienced domestic violence or sexual violence. And so we've had to try and navigate all of those things also with our folks and helping to keep them safe. So I appreciate all the community, all of the folks that have been making those wonderful masks in the community, and all of the support that everybody has given all of the agencies here.
Yeah. And thank you for everyone who's posing some questions in the Q&A. Looks like some of our panelists are jumping in and answering specific ones, but I'll pose a couple of them to all of you. And then anything we don't get to, we'll try to touch on in a wrap-up email that you'll get. in a couple of days. So we've talked about, or some of you mentioned some of the funding sources that have helped, but we know nonprofits are reliant on fundraising and donors and events. And in fact, you know, one of the biggest motivations for United Way to launch the relief fund was seeing, you know, in early March that you were all having to cancel events in the spring that usually bring in a significant amount of your revenue. How's fundraising going now? How's the community responded? And are you doing events that bring in that revenue, whether they're virtual or otherwise? Are you planning things for the fall and winter? Are you concerned? How's this part of the puzzle going? Anyone who wants to start, go ahead and jump in. Anyone in the audience with something to contribute's welcome to put it in the chat box as well.
So while they're thinking about their fundraisers, I'll just say that United Way, Community Foundation, Bloomington Health Foundation, the city's Jack Hopkins Social Service Grant, I think you all did a wonderful job of just coming up with resources in a very short amount of time, and funding some of the things to help our most vulnerable residents in Bloomington. So I wanted to thank you and all those other funders out there that did this, because everybody really just turned on a dime. Like, nobody was anticipating this, and certainly we weren't anticipating that it would go on as long as it has. And so I think that, you know, all of not only the physical protocols that have been put in place, that and the education that's been done, the peer support, you know, from folks at Wheeler and the health department, but also that financial funding. And I know that Jack Hopkins decided that in their funding stream this year, they prioritized COVID-related requests. And so just thanks to all those funders, and really I was just stretching that out to give them some time to figure out what they were going to do.
And really, you've been just such an amazing advocate, Beverly, for these organizations, for us, for the community and its most vulnerable, and the city has stepped up, and the county's stepped up, and the townships really has taken the whole community coming together. So yeah, does anyone want to jump in on that? And just real briefly, fundraising, is it a burning concern? Is it, what's the state of it?
I can speak for Shalom. I know they recently had their Solidarity Sleep Out, which is an annual fundraiser for Friends Place, their emergency shelter, virtually. And so usually people would go and sleep out in one space together, but this year it was done at our own homes. And we did reach our goal of raising $50,000 through that. But with that said, Shalom always depends on fundraising from the community to do what it does. And that's always a burning need for Shalom Community Center. So there has been incredible community support, and it was really awesome to hit that $50,000 goal and be able to fund Friends Place for an entire year through that. But they offer several programs, and it has been a challenge for each of those programs to still operate through the pandemic.
Yeah.
We had to cancel our spring luncheon. We're going to do a fall luncheon virtually. It's called an unluncheon, but it is challenging to try to plan. We can't plan events like we used to. We are still doing our tree sweaters throughout the community in October, starting in October, for domestic violence awareness. So that's something that we'll still be able to do, and hopefully the bright colored sweaters will make this winter a little brighter.
They always do, Debra. Yeah. Thank you. Okay, we have about 10 minutes remaining and some great questions here. I did want to pose to you, and we'll see if we can fit in more than just this last one, the question of how can we help? how can the community support you? We know dollars are always important, but talk a little more about how people can get involved, how they can be advocates for the needs of our homeless individuals and families. And if there are specific opportunities right now at the local, state, federal level, where maybe a piece of legislation is being debated or a plan is being crafted, can you point us to things like that as well? So maybe Dana, do you have any thoughts on that? How can our audience members help you and those you serve?
Oh, great question. Thank you for that opening. There's a lot of ways to which many of our community partners can help, and those who want to become a part of what we're doing here. Homelessness in Bloomington has been an issue for a long time, and an increasing issue. It's a very difficult problem to get around all aspects of it. But as far as helping Wheeler with the mission that we're doing here, Wheeler is not just a emergency shelter. We also provide programs of varying lengths to provide job readiness and soft skills training for those to re-enter the community from homelessness. So with that in mind, there are volunteers are a great thing. Although during this COVID-19 thing, we had to shut down our volunteer base, and that really was a big hurt to us as an organization, because we have a tremendous number of volunteers, and we love every one of them. So from food service to classroom training to working our front door for greeting and hospitality, they work in all aspects of our organization here. So when we had to shut that down during COVID, that made a huge impact. However, when the state protocols have been lightened, and we were able to get people back in our community here at Wheeler, it was great to have that. And we have protocols here. Of course, the face masks are necessary everywhere we go now, but we do have protocols on site where we are welcoming volunteers back. So please, if you want to volunteer, please do. We have a lot of protocols in place, but you do have to wear the face mask here. You do have to sanitize hands. And but if you go online at wheelermission.org and click on the icon there for volunteer and volunteer for the Bloomington site, you can sign up there's a multiple listing of things that people can get plugged into to do. So really need that. As far as fundraising, we've not been able to do anything this year. We've actually wanted to do some things and get some movement on that, but we have been unable to get anything going just because of the COVID. And we really don't know what to predict for the rest of the year. So of course, donor dollars are necessary. Wheeler Mission, and just for your information, Wheeler Mission does not take state or federal funding. So we are subsidized by donors, private donors, businesses, faith communities, and that's what keeps Wheeler afloat. So we really need that support currently to keep that on. Having said that, though, we've seen a tremendous outpouring of support over the last 4 or 5 months, which has been amazing, of people wanting to come up and help us with that. Unfortunately, during this period too, we had to suspend services at our Women's Center because that is not just COVID related. It was it was just unsustainable for us to continue to do that. Donations just weren't there to continue to sustain that. So I was asked, one of the questions is, how can we unsuspend those services there? And it's really we want to. We are calling it a suspension and hope that we'll reopen it one time. But we will need donor support to help to do that. So please keep us in your thoughts and advocate for that in the community. As we go forward from here in the pandemic, though, there's some things to keep in mind. Strategy is necessary. We've done some great tactics. We've done a lot of interesting things with tactics. I mean, we all responded well, but strategy needs to come to play. In the book, The Art of War, Sun Tzu said that strategy without tactics is the slowest route to victory. Tactics without strategy is the noise before defeat. So we want to have a strategy. And I think we have a lot of great thinkers in this community right here on this call that we can help put some things together to address the pandemic in the fall and in future pandemics. So hopefully in our generation won't see another one. But first, you know, some of the things to look at is the pandemic opened up some wonderful things as far as just communication. With Zoom, like we're doing now, it opened up those communication lines where not only could we reach out to site directors, but we can almost reach out to site directors daily. And so that's really been able to deepen that. And I really hope that that continues. Beverly has been a great help in that with the city to continue to deepen that and help that and retain that. Secondly, IU Health and other healthcare providers, they're active in our COC, but I really would love to see them to deepen that relationship with the COC so that we can have that relationship that when we are addressing these things as we go on through the pandemic in the fall, that we're able to collaborate at deeper levels. Because one of the things that we were concerned off early in the pandemic was that this virus would hit the homeless community and just spread like wildfire. So fortunately, we at Wheeler, as Chase had noted earlier, we've had no positive cases of COVID here at our site. But, you know, we are not done with the pandemic yet.
Yeah.
Third, the pandemic revealed the overcrowding of shelters, which you've talked about a lot. So what can we do with that? I think there needs to be a community discussion. We haven't seen real community discussion about homelessness for a while, about our direct approach to homelessness. We have the Housing First model, which many of the representatives here are part of. Wheeler is not, because we're not a HUD-funded organization. So I really would love to see an open forum inviting many other folks of our community in to address that. And then fourth, affordable housing. Currently, we have a great opportunity with the Bloomington, the old Bloomington hospital site there. And I know the city just had a virtual town hall meeting about that. And so please advocate for affordable housing in that area. I think it would be a great boon for us and our guests. And then finally, there's the Monroe County Communities in Disaster. That's an organization that is really working hard to organize our community to respond to the disasters around us. So I would ask that you to get behind that organization. And but finally, I'm like Chase opened. I'm just grateful to have been able to be a part of what's been taking place in Bloomington and the great response that occurred to address the homeless situation during this time and those at risk in our community. It's been fantastic to watch our compassionate community come together to resolve a lot of these issues.
Yeah, I echo that. Thank you. Any other, those are great action items. So hope everyone took some notes. Any other action items our audience members can take in the last minute here? Just rapid fire them at us.
Yeah, one of the biggest pieces, one of the biggest changes this month is that the eviction moratorium has lifted, which means that people can be evicted now. And many people who get evicted move on to another lease, they couch surf, they do something else. But many people and families will experience homelessness because, like we were saying earlier, people do not want to share their space right now. So we're not afraid of that. We are ready and we are professionals, but we are very concerned about the level of need that's going to arise in the coming months. So there is some good news. The federal government has released money through the state, some $600,000 in this region, our 6-county region, for rental relief. People apply through a central state portal, indianahousingnow.org, and they get connected with staff members at the Shalom Center or at New Hope for Families who can pay their back rent and even some future rent if they lost money due to the pandemic. So we really need people to know about that, landlords and tenants, that is in our community. That's one way to help bridge over some of these gaps. But that's not the only thing that people are going to need. They're going to need utility assistance, which is not covered by this grant. They're going to need a lot of things to help them negotiate a future with their landlord through the end of that lease. So if you are watching this and you have power, or you have a relationship, or you have knowledge, or you have access to funding, think about how you can leverage those things to prevent people from losing their lease. And on the flip side, if you may not have the way to connect to somebody who's already a tenant, think about how you can leverage those same resources for people who are currently in the shelter system. It's very difficult if you have an eviction on your record, if you have a felony, even if you have a felony that got dismissed. Credit checks, background checks in our city are very good at detecting if you have anything but a spotless record and a parent co-signing. So it's difficult to get in the door even if you have the money. So if you have,
we're getting some great suggestions and resources in the chat box. So indianahousingnow.org, thank you. And the Eviction Prevention Project. And in the follow-up email that you'll receive, we'll be sure to include a list of contacts for your elected officials at all levels that if you want to reach out and share, some of the things that are concerning you in regards to this topic, we'll put that information right in your hands. But we have reached an hour. I know we could go for hours on this topic. There's so many nuances and so many little things. I learned some things today. So I want to thank all of our panelists for being here this morning, but more importantly, to you and everyone you work with in your organization for the just tremendous work in recent months that I know, has been challenging to say the least, but so critical to our entire community and its health and safety. And you were right there on the front lines. Let's give our panelists a big round of applause. I know that you can't see all the audience clapping for you, but I'll do it on their behalf. And yeah, thank you to everyone for being here this morning. Our next Wake Up with United Way is September 10th, and it's going to be another interesting topic, human trafficking, combating exploitation and abuse. So Debra, I think another topic that crosses over into your world, but also we'll have some friends from the IU Center for the Study of Global Change with us that day. And we'll do it via Zoom. So keep an eye out for the sign up for that and for all the other topics every second Thursday of the month. So thanks again. And if we didn't answer your question, we'll try to get to it in the follow-up. And I hope everyone has a great weekend, a restful weekend, and yeah, keep up all you're doing out there. Thank you.